Hello, everyone. Welcome back to the therapy room. I am Shay Marriott, and today I am going to be talking to Taneka Johnson. She is a board certified psychiatric mental health nurse practitioner who focuses on listening carefully, understanding each person's story, and providing personalized treatment that fits each individual's emotional and medical needs. Taneka offers care for children, adolescents, and adults experiencing anxiety, depression, ADHD, mood disorders, and trauma-related symptoms, as well as emotional regulation. So today we're going to be talking to Taneka about depression and anxiety. What are the signs? What are the symptoms? And how can medication help us? Please welcome to the therapy room, Taneka Johnson. Hi, Taneka. How are you?
I am well. How are you, Shay?
I'm wonderful. Thank you so much for taking time to talk to us today. I'm so excited about this topic. I know it's important for people to understand, their options and how medication affects them. Mm-hmm. So the first question I have for you, there's a lot of stigma around mental health medication. So what are some of the biggest misconceptions people have about taking medication for anxiety and depression?
So I think one of the biggest misconceptions is that taking medication is a sign of weakness, or that people should be able to just snap out of it. Another misconception is that medication changes your personality, or like makes you numb emotionally, when in reality the goal is to reduce symptoms and return people back to their normal functioning cells.
Right. Okay, that's good. So how does psychiatric providers determine whether someone may benefit from medication versus therapy alone, or maybe a combination of both?
Right. So we look at symptom severity, duration, how long the symptoms have been affecting them, how much the symptoms impact their daily function. And also the patient's preferences. Mild symptoms may respond well to therapy alone, while moderate to severe symptoms often benefit from a combination of therapy and medication therapy.
Okay, good. So Taneka, I have heard that people are afraid that medication will change who they are. What would you say to someone who is hesitant to start medication because of that fear?
We would tell patients that the goal is not to change who they are. It's to help them feel more like themselves again. If a medication causes unwanted changes, though, we can adjust the dose or try a different option.
Yeah, that's good. So what should patients realistically expect during the first few weeks of starting like an anxiety or depression medication, and how can they navigate potential side effects?
So most medications do take several weeks to show their full benefits. Some people may experience mild side effects initially, which I do, inform them of, things like nausea, headaches, fatigue, but these often improve over time. So I just tell them, try to give it a little bit longer, and see, if it subsides. Hopefully, usually it does. Communication with me is important during this adjustment period.
Okay, good. So what role would you say that self-care, lifestyle changes, and therapy can play in managing anxiety and depression alongside of the medication?
Right. Well, medication is just one tool, right? Therapy, regular exercise, healthy sleep habits, stress management, social support, all of that plays a role in recovery and long-term wellness. I definitely encourage people to exercise, eat better, because we know it's easy to eat wrong.
Right.
So I definitely encourage better sleep habits and sleep hygiene. We tend to fall asleep looking at our phones and things like that. Screens are not good before bed. So all those little adjustments definitely makes a difference.
For sure, for sure.
Mm-hmm.
Do you think anxiety and depression, do you think it's becoming more common, or are people simply more willing to seek help?
I think it's likely both.
Okay.
I think life stressors have increased for many people,
Hmm.
but we're also seeing greater awareness of mental health and reduced stigma, which encourages people, to seek treatment.
Yeah, for sure. What are some of the warning signs indicated that someone should seek professional help rather than trying to manage their symptoms on their own?
If symptoms persist for weeks, if they interfere with work, school, relationships, sleep, or daily functioning, it's time to seek help. Anyone experiencing thoughts of self-harm or suicide should seek immediate professional support.
Okay, that's good.
Mhm.
So, in closing, Tanika, what message would you like to give someone who has been suffering in silence and is afraid to ask for help?
So there is so much support out here. You do not have to go through it alone. And reaching out for help is a sign of strength, not weakness. Treatment works, recovery is possible, and taking the first step can change your life.
Awesome. Thank you so much. It's always a pleasure talking to you. This was a very informative conversation. And if you guys are looking for therapy or would like to try to give medication a chance, a try, or both, go to the centerforchilddevelopment.com and you can actually reach out to Tanika directly. You can schedule an appointment and you can also find a therapist there. Or you can simply just call our office at 302-292-1334. Tanika, thank you so much
Of
again
course.
for coming to the therapy room. And we're going to have you back. We're going to have more conversation about different diagnoses and medication and how we can help you and support you on your mental wellness journey. Thank you again for tuning in to the therapy room.